It is imperative that healthcare professionals model healthcare versus sick care if we have any chance of saving our country. I suspect there's up to 60% of people walking around with some degree of insulin resistance, which we could call prediabetes. But if you're full-blown diabetic, it's only then that your doctor is going to start acting. And it's partly because your doctors aren't taking care of themselves. It is not okay to have a hemoglobin A1C of 6, even if your doctor says you're not yet diabetic. No, that is bad news, guys. And many doctors, as I said in my first part 1 of this series, they're already diabetic. But these videos are specifically aimed towards the healthcare professionals that say, I don't have time, I don't really know what to do, I'm here for you, let's do this. 5 foods provided by nature that are gonna give you adequate nutrition for everything from preconception through your childbirth, through your postpartum period and your lactation. Every angle will be covered nutritionally if you're eating these 5 foods. Farm fresh eggs, really high quality fish oil, ideally a cod liver oil from a company like Nordic Naturals or a fermented cod liver oil from a company like Green Pasture. Bone broth made from the bones of regeneratively raised, responsibly raised cows. Beef liver, bivalves like clams, mussels, and smoked oysters, which are my favorite. There was a dentist who was traveling the world looking at people's teeth, looking at their diet, looking at a lot of their chronic disease indicators on physical exam. His name was Weston A. Price, and he developed an entire theory around how we in the West are eating too many processed foods and not eating enough whole foods and organ meats and things like that, and that's why our health is sliding. There's also the aquatic ape theory, which suggests that things like preeclampsia are arising in our pregnancies in the West because we're living too far from shores and we're not eating enough bivalve shellfish. So what I do is I wake up, I usually don't eat anything until about noon, and I try to get as many of those 5 foods into my diet on a regular basis. Why am I suggesting these 5 foods? Well, first off, nature delivers the various nutrients and vitamins that you need in great proportions to one another. So you're gonna get plenty of copper, zinc, selenium, molybdenum, manganese, magnesium, a variety of different vitamins. You're gonna get all of that packaged into a vehicle that have them in proportions that are going to be most bioavailable and useful to your tissues. These foods are also going to support a healthy gut, which is how you digest and absorb those nutrients. And all of those nutrients I mentioned are generally pretty scarce in the standard American diet, the SAD diet. If you're gonna eat produce, make sure it's organic. Not just because you don't want glyphosates and other herbicides and other artificial fertilizers on your food, but also because foods that are grown in healthy soil are going to be overall more nutritious. And when we use these artificial additives to our farmlands, it depletes the soil's ability to take in nutrients through the roots and put it into the fruits and the leaves and the shoots that you will then put into your salad later. I think it's also relevant to be reminded that the hospital cafeteria in your medical institution likely has some of the crappiest food options on the planet. So you need to start preparing your food. By preparing your food, you know exactly what's going into it, and you get to connect with your food, which is so important from an energetic level. This food is going to nourish you. Maybe you get pregnant, it's going to nourish your baby. You want to be connected to that food and to the farmers that produce that food. Finally, notice I haven't said you have to take anything out of your diet. Here's what I recommend doing. Start by trying to add as many of nature's multivitamins into your diet as possible, those 5 foods that I mentioned, and then slowly take out all of the processed sugar and the flour and all of those other things. It's not supposed to be perfect. Your journey is your own. It's going to take a long time to get this right, but when you do, you're going to feel better, you're going to perform better, you're going to look better, everything will change. And then when your clients come to you for lifestyle advice, you're going to know what to tell them because you know through self-experimentation what works best for you. Good luck.